Oh my goodness, you are in for a treat today. Welcome, everybody. It is Frankie Boyer, and you are, this show is heard now on a new station. Welcome, WNKC in Indiana. We're so thrilled you're with us. And of course, we always love WADK in Newport, Rhode Island, and then our home station, WCRN Boston, Worcester. Okay. Heart disease, the number one killer in this country. It is still the number one killer in this country. Yet, one would never know that by the way we as Americans live our lives. Because not much has changed, unfortunately, since COVID. Joining us today is an interventional cardiologist. Dr. Christopher Davis is here, and he's Chief Executive Officer and founder of Manatee Cardiovascular Wellness Institute. He is also the founder and CEO of Reveal Vitality. After medical school, Dr. Davis trained at the prestigious Johns Hopkins Sinai Hospital for his internal medicine residency, recognized as an incredible talent and his commitment to his patients. He is with us today, and we're talking about why stress is so dangerous to not only your body, but to your mind. And Dr. Christopher Davis, welcome to the program.
Well, thank you, Frankie. It's my pleasure being here. I'm super excited to talk to you about this issue.
So we want to, first of all, put out the symptoms of the physical results of stress. So give us what they are.
Sure. So some of the more common symptoms that we see are anxiety, fatigue, chronic pain, chronic inflammation, I'm not sure if insomnia, unexplained weight gain. Those are some of the most common presentation symptoms. I think that when we talk about stress, one of the most common symptoms that people come to the doctor's office with is, I'm just so tired, I'm just so fatigued. I sleep and I wake up and I don't feel well rested. And a lot of times it has to do with ongoing stress or chronic stress.
And what's going on as a result of this chronic stress month after month after month? What is it doing to us?
Right. So here's where it gets a little bit, it's a little interesting because, acute stressors, exercise, for example. Exercise is a stressor. However, we don't think about exercise from a negative perspective as far as causing damage. So when we have acute stressors, our body utilizes some of those acute stressors to actually help strengthen our body, strengthen our resilience. That concept is called hormesis. It's when that acute stress goes on and on and on and is not combated and quelled when it needs to be that we develop more of this chronic stress issue. So what happens during this chronic stress? When we think about stress, first of all, there's a lot of different types of stress. There's emotional stress. There is traumatic stress. There is chemical stress. So I think when most people think about stress, we're thinking about that emotional component, which is very important. But we have to think about those other stressors. Alcohol is a stress, and smoking is a stress. So what happens in our body? That adrenal gland, which is actually a gland that sits right above our kidneys. Our kidneys, obviously, is what helps us clean out all the toxins in our body. One of the organs that does that. But the adrenal glands sit right on top of the kidney. And those adrenals are responsible for producing something called stress hormones. So what are the stress hormones? Cortisol, noradrenaline, adrenaline, or epinephrine, norepinephrine. So when you're stressed out, it's not just that you feel emotionally stressed out. You are actually having a production or overproduction of these neurotransmitters that, again, can be something that we need at times. For example, you're being chased by a bear. You want those stress hormones to kick in and you want to get the heck out of there. However, long-term continued elevation of these stress hormones leads to these issues, inflammation in our body and insomnia and all the other things that we talked about.
How does lifestyle what role does our lifestyle have to do with this scenario, this story, doctor?
Absolutely everything. Absolutely everything. I think that when we talk about stressors, when I mentioned, yes, we have the emotional stressors, but a lot of the stressors we bring upon ourselves, meaning what we choose to eat, what we choose to put on the end of the fork, all of the trans fats and all of the sugar that we eat, the lack of other good nutrition, whole foods, the vegetables that we need to eat. So those play a very, very important role in the stress, because alcohol, too much alcohol, those stimulate those stress hormones so that they are chronically being produced, and you end up in that situation that I talked about, the overproduction of all of these stress hormones. So sleep, not getting enough sleep, that actually causes a lot of stress on the body, because we can't clean out the toxins in our brain when we don't get the deep sleep that we need. There's a system in our brain called the glymphatic system. And that glymphatic system only works, it opens up and gets those toxins out when we're getting a lot of deep sleep. When we're not getting that deep sleep, those toxins start to build up, and you have all these neurocognitive issues, brain fog, I can't remember names, I can't remember words. So lifestyle plays a very important role. Lack of exercise, not getting enough, not enough movement. Again, I told you how exercise can be a good stress, but when you're not getting any of it, that has a lot of negative consequences as well. Lifestyle, the water that we drink, I could go on and on. The toxins in the environment, the heavy metals, the plastics, the pesticides that we're exposed to. These are all stressors that end up causing a lot of these persistent elevations of those stress hormones.
So, as Americans, why is this not a major piece of the agenda? Why are we not spending money on press releases and PSAs for this?
Wow, that's $1 million question, Frankie. One of my missions with my medical practice, and I think that just garnering what I've heard from your show, that's one of the missions from your show. I think we have to change healthcare. We have to change our approach to healthcare, and it's going to have to come from each and every one of us, each and every one of your listeners. It's going to have to come from you, each of us taking a more proactive role in our health and understanding that there are things in our lifestyle, there are things in our environment that are continuously making us ill. Unfortunately, a lot of our society is financially driven. It's driven by, for example, one of the things I do when I talk in my talks, I put a slide up, and there's these cereals like Lucky Charms and Fruit Loops, and on the side of the box it says, a big old check that says American Heart Association, right? The stamp of approval from the American Heart Association. So in itself, you can see there is a problem. There's an agenda. How can Lucky Charms and Fruit
Isn't that insane? How could the American Heart how do they approve those foods? And then we have comorbidity where so many tens of thousands of morbidly obese people died from COVID.
Yeah. So
gosh. All right. When we come back, we have to take a quick break. Give us the website, and you also have some suggestions on how to relieve all of this and what we should really be doing with our lives. And give us your website, please.
www.revealvitality.com. www.revealvitality.com. Nutrition. Let's start with nutrition. The 5 pillars of health: nutrition, exercise, sleep, detoxification, and stress and hormone balance. Those are the 5 pillars that I talk about, and I talk about every one of my patients. And so
we'll be back in a minute. Absolutely. We'll be back with the doctor in just a moment. It's revealvitality.com, REVEAL, vitality.com. Stay tuned. I'm Frankie Boyer. This is WCRN, WADK, and WNKC. Stay tuned. And welcome back. Interventional cardiologist and chief executive officer and founder of Reveal Vitality is with us today. His name is Dr. Christopher Davis, and welcome back, Dr. Davis. This is Frankie Boyer, WCRN, WADK, WNKC. This is a story, everybody. You need to listen to what Dr. Davis is saying to you, because it's very obvious to me that no one really cares about your health but you. You should be in charge of your health. You. And Dr. Davis, what are the things that we need to do right now, today, to change the outcome that we're going to die from a heart disease or from stroke? Or stress.
Or stress. So let's start with learning. Let's start with stress. Let's talk about that, because I think that we know, honestly, if you look at some of the literature, increased stress levels actually have more of a predictive outcome than, say, cholesterol or hypertension when it comes to heart disease and arrhythmias, believe it or not. So learning to deal with those stressors or how you combat stress is really important. And I don't think that a lot of us really have mechanisms in place or even have even been talked to about, well, how do I deal with stress? And it's just something that we all have, and particularly after this whole COVID ordeal over the last couple of years, I think we're all even more stressed. So I would encourage all of you all to really look into, I think some of the most powerful stress relieving techniques are learning breath techniques or breathing techniques. And there are lots of different breathing techniques out there, and I really can't cover them all, but I like to use some of the apps that you can use on your phone, Breathe, Calm. There are a few apps that you can learn breathing techniques on your phone. One of my favorite entities out there that teaches about breath work and dealing with stress and achieving something called coherence, which is getting your brain and your body or your heart on the same plane, on the same frequency, is an organization called the Heart Math Institute. The Heart Math Institute. So you guys can Google the Heart Math Institute, and they have a few little devices. I find it hard, even for myself, to meditate at times and work on breath work, but they have these little devices. One's called the Inner Balance, INNER Balance, that you can utilize and put it on your finger or your ear, and it teaches you breathing techniques that really helps you get that heart-brain coherence and deal with the stressors. It really balances your, what we call the autonomic nervous system. The autonomic nervous system is a combination of what we call that sympathetic system or fight or flight system and the parasympathetic system, which is what we call rest and digest. And where we are when we're all stressed out these days is we're really in a sympathetic state where my heart's beating fast and I'm sweating, my mind's racing. And what we need to do is really have a way to bring that sympathetic and parasympathetic tone back into balance. And that breath work is a really great way to do that. And utilizing the heart math, the techniques, and utilizing their devices, that would be something that will be helpful. I could go on about kind of how you could start to learn about how your autonomic nervous system is doing, and that's measured by something called heart rate variability. I think it's a little much to go into now. Maybe we could talk about that later, but a lot of devices, your Apple Watch, your BioStrap devices, Whoop bands, and your Oura Ring. My favorite device that I use daily is a ring called an Oura Ring.
Oh, I've heard about this, the ring, yes. I've heard it's magnificent.
The Oura Ring is absolutely fantastic. And when you're talking about dialing into your health, your point about taking responsibility for your own health, the Oura Ring is a fantastic way to do that because you learn things about your body. You learn things about your body.
Yeah.
So you learn things about your body that affect it.
Joe has a question for you, Doctor. Hi, Joe.
Yeah. Hi, folks. I'm scratching my head because I read a story a couple of months ago, hadn't heard anything since. As of April 21st, there was a grand total of 769 athletes, mostly professional athletes, who had collapsed on the field in play or in practice. And cardiac issues seems to be the thing that gets mentioned consistently in the Miami Open. 15 tennis players withdrew with cardiac issues. I mean, but it's mind-boggling that there's no mention of this. These are verified cases. Can you shed any light?
Great question.
Sure can. That's a great question. And I'm going to say this. When we think about coronavirus, it is, I think most people think about this as a lung or respiratory disease. Coronavirus is a vascular disease. It is a disease of the endothelial cells, of the endothelium, which is the inner lining of our vessels. So 100% coronavirus is a vascular disease. And what we know is that spike protein actually interferes with normal endothelial function. And what does the endothelium do? The endothelium is responsible for preventing blood clots from forming in the vessel. It's responsible for producing nitric oxide, which dilates the vessel and controls our blood pressure. It's responsible for how other cells like the cholesterol molecules get into the wall of the vessel and other white blood cells, how they get into the what we call the under the endothelial lining into the vessel wall and to cause plaque buildup. So we know that because of the spike protein damage, we are now seeing more blood clots. We're seeing issues with hypertension. In my practice alone, the incidence of hypertension has gone up tremendously in people who've never had hypertension, simply because of the effect of the spike protein on the vascular wall binding to ACE receptors, ACE2 receptors. There's a little more depth to that, meaning that on top of the endothelium, there's a layer called the glycocalyx. And the glycocalyx is kind of a layer that keeps everything nice and slippery on the inside of the artery. Well, that glycocalyx is kind of washed away and destroyed as well. And so, again, now we have an endothelium that's now being attacked by the spike protein. So we are seeing a lot more of these issues in athletes. Now, why more in athletes? I think that I don't know that what I would say to that is I think there's more of these cases that are happening in lay people as well. We're just hearing more about the athletes. I can tell you that I've seen a number of cases of people with vascular events. There's one other factor that kind of goes on with this too. We're going to go back to the sympathetic tone again. I'm going to go back to that stress hormones being high. We know that with coronavirus also that the sympathetic tone, the other thing that we see is a lot of people with palpitations and arrhythmias, meaning heart beating fast, because sympathetic tone is also upregulated with the COVID-19 infection. I think we have seen similar things with vaccines as well, simply because it's a similar mechanism. Spike protein is being produced by a vaccine, and it can cause similar type scenarios. And we've seen myocarditis, and we've seen people who've had heart attacks, and the mechanism is exactly the same as with coronavirus.
Hey, crazy. Thanks for the call, Joe. So appreciate the question. Dr. Davis, we only have a few moments left with you. Dr. Christopher Davis is our guest. He's an interventional cardiologist, and it's revealvitality.com. Doctor, tell me, if you could, as the extraordinary cardiologist that you are, looking at whole person living, 5 recommendations to keep the heart healthy would be?
Eat real food. Okay, what does that mean? Avoiding processed foods. Drink clean water. Okay, spring water if possible. If not, if you have a RO system, reverse osmosis system in your home, adding minerals to that reverse osmosis water to get some of those minerals back in the water. So drinking clean water. Exercising, of course. Avoiding other toxins in our environment. Know the things that are problematic. Know plastics that have BPA. Know the chemicals that are in the pots and pans that you cook with. Those toxins are super problematic when it comes to chronic illness. So that's 4. And then sleep. Sleep is probably one of the most under talked about risk factors for chronic illness that there is out there. We really don't pay enough attention to sleep. Another reason to really utilize that aura ring to look at the type of sleep you're getting, deep, REM, light sleep, super important.
Your favorite vitamins?
Vitamin D, CoQ10, magnesium, and fish oil.
Yes, absolutely. Absolutely. CoQ10 is so critical, isn't it?
Absolutely. Your body can't produce energy. You can't produce the battery pack. Battery packs can't work without CoQ10.
We're almost out of time, but Stephen Sinatra, Dr. Sinatra, who I know you work with, a colleague of yours, has shared remarkable stories about patients coming back from the death because they were accidentally given too much CoQ10 and walked out of the deathbed.
Yeah.
It's such those are great stories. Doctor, thank you so much, Dr. Christopher Davis. His website is revealvitality.com, REVEALI, Reveal Vitality, VITALITY.com, revealvitality.com. You are coming back, and I'm so thrilled. So we'll set a date for you to be on for the full hour. Thank you so much for being with us today, Doctor. Oh no, it's our pleasure. This is Frankie Boyer. We'll be We'll be back in just a moment. WCRN, WADK, and WNKC. Stay tuned.